Hi, I'm Dr. Steve Myers, and I'm here with my patient Elizabeth, who is 1 year out from a right knee stem cell procedure. Before we talk to her, we're going to take a quick look at her x-rays and see what kind of issues she was dealing with. Okay, so taking a look at her x-rays, this is an x-ray of her right knee from before her procedure 1 year ago on this side, and over here is her right knee x-ray from today. Looking 1 year ago, if we take a zoomed in view of her right knee, you can see that she has good amount of dark space. This is the cartilage thickness in the joint. She should have the same amount of dark space and thickness on the inside, and she's lost a significant amount of the space. If I zoom in here, you can see that she's got significant loss of space on the inside of the knee, and I was able to actually measure this space, and the joint space at this point in time was 1 millimeter. And on this side over here, if we zoom in, you can see that the space on the inside of the joint has actually increased. I hope you can appreciate that this dark space on the inside of the knee is actually taller at this point in time, more dark space than what was happening a year ago, right before her procedure. And I'm actually able to measure this space, and at this point in time, before her procedure, her joint space measured 1 millimeter. And now, 1 year after her procedure, the joint space thickness is 2 millimeters. So that's a 100% increase in the joint space 1 year after her stem cell procedure. All right, so thinking back to a year ago, back when you came to see me about that right knee, describe your symptoms. What kind of issues, what kind of trouble were you having with your right knee before we got into your stem cell treatment?
I was having a lot of difficulty walking because it was very painful. I had, I wasn't able to exercise because it was causing too much trouble. And I did not want to have knee replacement surgery because it wasn't, I didn't feel it was necessary yet. So my doctor sent me to you because you were doing stem cell.
And what kind of treatments did you try before we got into a stem cell procedure?
I had a gel injection that caused, I don't know if it was the gel or the way the injection was done, but it caused a lot of trouble and made my knee much worse.
Okay. Other treatments, I think you tried a steroid injection and some physical therapy as well.
I did physical therapy, which is helpful, but it still didn't solve the problem.
And why ultimately did you decide on stem cell for your treatment option?
My husband has a cousin who had stem cells and had good luck with that. And so I thought it was worth taking that opportunity and seeing if it would work for me.
So here we are 1 year out from your stem cell procedure. How are you doing?
It's much better. I'm able to ride my recumbent bike. I don't have the pain that I was having. I still have arthritis pain sometimes, but that's a different issue because that's everywhere. But I'm able to walk and do things that a year ago I couldn't.
Fantastic.
Yeah.
Having been through it a year down the road, do you feel like you made the right decision with your treatment choice?
Absolutely. I didn't have the downtime that you do with surgery, and I've had improvement, and I never had any pain from the procedure.
Okay.
So it was certainly worth a chance of seeing if it would work for me.
Well, thanks so much for coming in and sharing your story with how you're doing. I appreciate it.
I appreciate the good work. Thank you.